Hi my loves, welcome or welcome back to today's video. If this is the first time you're seeing my face, hello, my name is Sylvia and I'm a fifth year medical student. I'm also a skincare lover. So on this channel, I share my journey with skincare and I also share skincare tips that could help you as well. So do well to subscribe and stay subscribed to my channel. And as you've seen by today's video, I'm going to be giving you guys a little bit of an update. So I'm going to be doing my usual sit down chit chat, kind of discussion where I just sit down and just put you guys through. So I haven't been consistent and I feel like you all deserve to know why. Now this video is actually unplanned, unscripted. I just got back from school. It's currently a few minutes past 5 and this video is just going to flow as it is in my head. So I'm just going to be gisting you about 500 levels so far, how it is in my school, how the whole process has been, because the last time I did something like this I got comments from persons saying they enjoyed something like that. So here it is and here I am again, just going to give you, or it's going to be a super interesting chit chat. Anyways, if you have any questions concerning anything, I don't know, but you can ask me in the comments, but please, not any medical advice yet, just yet. But anything about maybe medical school or any questions that you might have, just let me know in the comments and I'll be there to answer all your questions. Okay, so starting off, we started in my school. Like you all know, I'm in a public university in Nigeria. So in 500 level, initially when we start, we mostly do postings, or what you guys may know as clinical rotations. So I started with medicine and I was posted to cardiology and we were there for like 6 weeks. We went through cardiology, everything about cardiology. If you don't know what cardiology means, it just has to do with the heart, study of the heart. And yeah, that's just in basic simple terms. So we were there for 2 weeks and then after 6 weeks, and then after 6 weeks we now moved to psychiatry, or better known as mental health department. And we had to stay there for 1 month, and I kid you not, that was like the best 1 month since I've ever done clinical postings, funny enough. Contrary to what other persons say, I actually enjoyed mental health department. I mean, first of all, when I say these things, people are like, why do you always like, why do you like mental health? Well, I don't know, I enjoyed my stay there. Thought it was like really, really fun. No, not fun. Not use the word fun. I think I really enjoyed it because it was just different from the regular clinical medicine where you have to. And I don't know. This one you had to do more with logic, I should put it that way, reasoning, thinking. It's actually more abstract because you just have to ask questions. It's giving detective. I'm just kidding. But yeah, so that's just how it is. It's actually more abstract or than the like regular clinical medicine. Though you may do some, hands on the medicine depending on the condition the person is presenting with. But like I said, it's more about interactions with the patient for everything or most of the things. And over here in Nigeria, our clinical medicine, we are mostly taught to diagnose based on history taking. So your history taking skills have to be thorough, clinical skills have to be thorough. We don't really, like, should I say we don't really, but we mostly do history taking. I mean, that's what really aids our diagnosis, because I mean, we're in this part of the world, so you really have to take that part of your learning seriously. And then the history taking in mental health or psychiatry department, however you want to put it, is almost the same. Is it almost the same? No, it's not almost the same. Is a bit similar, just a bit, just like 10% similar to the normal history taking in other like specialties, but because it has to do with the mind, it's different. There are differences, and I actually found that very interesting. To me, I'm always finding everything interesting. So like I said, it's actually just more abstract. So and then you learn how to do the mental state examination, everything that we taught, and just all this is just to aid in your diagnosis. So what else? It's actually very nice 1 month stay because we had to be there for 1 month. I can't even lie, I was always scared. I was scared. And then there are rules in the department, like don't wear earrings, don't wear ties for like the guys, don't come with your ward codes. And then yeah, the consultants and the registrars, they're like, I'll call them behavioral experts. So they were like pretty chill. It was actually a really chill. It was actually a really chill 1 month. Like the posting for that month was really chill. And like I said, I was always scared because I mean you're dealing with patients with mental health issues, so I was just a bit scary, just a bit initially. But I think after some days, I just got used to the environment, got used to everything, and I actually found it interesting. And then this is just like just a quick story of a tip or a pretty boy, an advice. So there are some persons that are like actually like genetically predisposed to having mental health problems, but they may not actually come down with these problems, depending, or if they actually do come down with them, it depends on their lifestyle. Yep. So certain things actually trigger the onset of these mental health problems, and commonly, yes, you guessed that right, substance abuse. So my loves, just stay away from substance. I'm not seeing any advantage or long-term advantage of substance use, so please stay away from substances of all sorts, every sort, every every and then you get to see cases like cases that actually, I mean, cases that sound abstract, like schizophrenia, bipolar disorder, ADHD, mood disorders. Like I actually get to see it and diagnose it in real time. So I actually really found that interesting. Like I said, it's not like the other, hands-on kind of medicine. So like I really actually found that interesting. So after psychiatry, we did psychiatry for like a month, like I already said. And then we moved over to what we call special postings. Now, special postings are under surgery, but for some reason that I really don't know and I can't explain, they're not under with the other core surgery departments. They're like subspecialties and they have their own departments and they're just classified under special posting. Yeah, the posting is just classified under special posting. And in my school, it includes, let me start from where I started. ENT, that is ear, nose, and throat, anesthesia, orthopedics, ophthalmology, and radiology. So those are the five. That's five special postings or departments under special postings in my school. So I've just listed them in the order of which I did, but I haven't yet entered radiology. Radiology is starting next. I will start radiology next week, but I was supposed to post this video around next week. So I started from ENT, we did ENT for a couple of weeks, and it was also really pretty chill. Like my school was really pretty chill. Got to learn about the ear, the nose, and the throat. Got to learn how to examine and do those stuff. And yeah, I think I actually found it chill. What do I not find chill? And this is just another advice because this one actually concerns me. It was something I used to do and I suffered for it. I paid heavily for it. Now, if you're the type that likes using cotton buds, surprisingly, I learned that cotton buds are for cosmetic procedures. Right? Surprising. And maybe art, I don't know, but any other thing aside the ear. So growing up, I know I wasn't actually taught that, but somehow I just felt that cotton buds were for cleaning the ears. But that is wrong, dangerous practice, and I actually had to pay for it. Now, how? Now, what happens is that when you're using a cotton bud in an attempt to clean your ear, now the ear, not surprisingly, the ear is actually self-cleansing. God puts all these things in place, and He knows and He sets these things to regulate themselves. Okay, so the ear is actually self-cleansing, and the earwax that you try to remove because you feel like it's dirt, it has functions, it has protective functions, lubricating functions in the ear. So try to take it out in an attempt to take it out using the cotton bud. You don't actually take a good, like, you don't actually really take it out. You tend to push a larger chunk of the or push the earwax deeper into your middle ear, and typically it's not supposed to be so, and it could cause reduced hearing or reduction in hearing. And if you actually succeed in taking out a good number of or a good amount or a good quantity of the earwax, maybe using a pen cover, oh my god, please don't use these things in your ear, using a pen or the cover of a pen, like I said, it has protective functions. You lose the ability because this earwax helps to trap dirt and certain things that may want to go into your ear, so you will lose that function and it will predispose you to coming down with infection. So if you ever notice pain or itchiness or just discomfort in your ear, please do well to visit a specialist. Anyways, please don't be like me, because I actually had to suffer. I had to spend money on good antibiotics just for my ignorance. But yeah, that's why you have me, so you don't have to make the same mistakes. So after ENT, you move to anesthesiology, and from the name anesthesia, just has to do with everything that has to do with anesthesia, analgesia, sedation, and before surgery, oxygen therapy, and all that. So we did that for 2. So I won't rely. I can't exactly say I really enjoyed my, I don't know, posting anesthesia for the first time, right? I feel like we just had too much information to consume in such a short time. I mean, it's pretty chill, but I feel like we should have been given more time. But regardless, we'll pull through. And then we moved to orthopedics. But during that period, I was so actively involved in the planning and preparation of and hosting of our school's health week, and it was a success. Thanks to glory, all glory to God. It was actually a success. And then during my stay in orthopedics, I witnessed a surgery. There was this peculiar case of this lady who had a gunshot to her femur. And then after the bullet was removed, she had to have a skin graft to help with the cosmetic appearance of the wound while it's healing. And yeah, it was really pretty chill units. Then after orthopedics, I'm currently in ophthalmology. We have to learn, we are learning everything about the eye. I just got back from posting from clinic. I mean, we actually stayed longer than we should have, but it was productive. So I think it was worth it. I mean, I'm learning, so it has to be worth it. But yeah, it was longer than it's supposed to be, but it was actually a productive time. So yeah, I think I like ophthalmology because it's more structured than like in my school, just more structured. I think it just depends on the HOD, head of department. So you just have to learn, like you have to learn. So next week I'm going to be doing radiology, which is the last. I'm going to learn how to interpret radiographic images. Wish me luck. But yeah, so far I've actually had a nice time in special posting, and I had a nice time in mental health. So yeah, that's all that has happened so far in fifth year and how fifth year is in my school. If you have any questions, any clarity on medicine, please, not medical advice, let me know in the comments. I'll be there to answer your questions. If you love this video and you want more sit down chit chat gist videos like this, let me also know. And we'll be having more skincare content coming up. So please, if you love content like this, subscribe to my channel, okay? So that you get, and turn on post notifications so you get notified when I post new skincare content, because there's, I mean, content loaded, okay? I mean, now I'm less engaged, so not less engaged. I mean, I have school, but I don't have an event I'm planning. So yeah. So if you've not subscribed at this point, please subscribe, like this video, and see you on my next video. Bye.